Disease Control and Prevention. I'm delighted to join everyone this afternoon to provide you an update on where we stand with respect to COVID-19 across the state of Maine for today, Wednesday, November 4th, 2020. And I begin today's update on a sad and somber note. Maine CDC is reporting the deaths of 2 additional individuals who have recently passed away with COVID-19. One was a woman in her 80s from Franklin County. And the other was a man in his 70s from Waldo County. Their passings mark the 149th and 150th deaths among people with COVID-19 in Maine. Let us today take a moment to mourn not just their deaths, but also at the same time recognize the grief that their friends, families, and communities are currently experiencing. To those family members who are grieving right now, we offer you our condolences. May the fond memories of your departed loved ones be with you always. Right now, across the state of Maine, there are a total of 7,077 cases of COVID-19, representing an increase of 151 new cases since yesterday. Of those, 6,241 are confirmed, an increase of 104, and 836 are probable, an increase of 47. Cumulatively, 507 individuals have been hospitalized, and 43 people have been hospitalized just in the past 30 days. Right now in the state of Maine, 36 people are hospitalized with COVID-19, 12 of whom are in the ICU, and 2 of whom are on ventilators. That equates to a hospitalization rate of about 2.7 hospitalizations for every 100,000 people in Maine. The national rate right now is 14 hospitalizations for every 100,000, but our rate is increasing. To put that number in perspective, just yesterday, 31 people were hospitalized, and today it's 36. Compare that to 2 weeks ago, when there were only 7 people in the hospital in Maine, none of whom was on a ventilator and none of whom was in the ICU. As I mentioned, we've now recorded 150 deaths of individuals with COVID-19, and 5,682 have recovered, an increase of 51 recoveries since yesterday. Finally, among our cases are 1,209 healthcare workers. Zooming out just a bit, of the cases reported to Maine CDC yesterday, 41% were from Cumberland County, and 15% were from Kennebec County. I'd like to now turn to some of the outbreaks that Maine CDC is following. And I'll start with some outbreak investigations that we have opened just in the past day or two. Yesterday, Maine CDC opened an epidemiological outbreak investigation into Calais Regional Hospital, where we are aware currently of 6 cases of COVID-19 associated with that hospital. This morning, we've also opened 3 additional new epidemiological investigations. One at Advanced Health Physical Therapy in Augusta, where there are a total of 3 cases among staff members. Also, an investigation into the CrossFit Undaunted Gym, also in Augusta, where we are aware of 3 patrons who have tested positive. And finally, also in the Augusta area, a new investigation at the Hope Baptist Church, where we are aware of 5 cases. All 3 of the outbreak investigations just opened today are in Kennebec County, a concerning sign that infection rates as well as new outbreaks in that part of the state are on the rise. I'd like to now turn to some updates around where we are with respect to testing. Let's start with the positivity rate. Right now, the positivity rate on a 7-day rolling average weighted basis for PCR tests in Maine stands at 1.30%. Again, to put that number in context, 2 weeks ago, the positivity rate in Maine was 0.5%. Today, it stands at 1.3. The national average for positivity rates across the country is at 6%. Another metric we follow is the testing volume, literally how many PCR tests are being done by laboratories across the state of Maine. And right now, that number stands at 572 tests per every 100,000 people in Maine. The national average for testing volume is 372 tests per every 100,000 people. I'd like to now talk about a couple of things going on within Maine CDC. The first is out of a desire to be transparent with where things stand within our own public health agency. I wanted to let everybody know that one of the team members within Maine CDC recently tested positive for COVID-19. We have temporarily closed the Maine CDC building to the public. We've also closed 4 floors within the Maine CDC to employees while we determine who among those employees may have been exposed to this individual who is now tested positive. The partial closure of our building, these 4 floors, has not affected our operations, whether that be with respect to testing, case investigation, contact tracing, or the distribution of PPE. All of those key elements of our COVID-19 response are continuing. They haven't been affected by this partial closure of our building. Our case investigators and contact tracers are doing what we would do for any case, which is identifying where and whether any other individuals within the Maine CDC building could have potentially been exposed. That process is wrapping up right now, and we expect to be able to reopen the building both to the public as well as to other employees who were not exposed, probably by tomorrow. I don't usually or typically report on single cases, but again, out of an abundance of caution as well as a desire to be transparent with where things are with your public health agency, I wanted to let everybody know where we are. This is not an outbreak situation. I just want to be clear. This is a single case, not an outbreak. But again, we wanted to let you know where things are because of the nature of the work we do at the time of COVID-19. And finally, before we turn to some questions, I wanted to take a moment to take stock of where we are across the state with COVID-19 and offer some granular tips that each and every one who's watching today can take to keep your family safe. Let's start by reflecting on where things stand. 2 weeks ago in Maine, we had 6,027 cases of COVID-19. Today, we have more than 1,000 more cases than we did just 2 weeks ago. Our positivity rate has more than doubled in the past 2 weeks. 5 times as many people are in the hospital. Even though the numbers of hospitalizations are low, which is encouraging, the rate is increasing. And we are on a daily basis regularly seeing new cases in all 16 counties across Maine. And flu season hasn't even started in earnest yet. What these data tell us is that COVID-19 has now affected every aspect and every geography across the state of Maine. It's affected gyms, restaurants, houses of worship, and more recently started to re-affect and reinfect places where it had been dormant for a little while, like hospitals and long-term care facilities. As I mentioned a moment ago, it's also spreading in places across the state where previously there had been few cases. Counties where activity of COVID-19 had not been pronounced. We are starting to see more cases spread across the state in zip codes and counties where previously the activity had been low. And so what I wanted to do today was to provide some concrete tips for things that you can do today to keep yourself, your family, and your community safe. The first thing is that even though it's not directly related to COVID, it is a direct way you can keep yourself safe. And that's to go get your flu shot. It is not too late to go get your flu shot. And you really do need to go get one because flu season will be starting to pick up very, very soon. But it is not too late to get your flu shot. Please, if you haven't done so, the most concrete thing that you can do right after we wrap up today is to find out a place to go get your flu shot and get that done today. Other things that you can do have to do with testing and how you can take care of yourself. The first is that if you are having symptoms that could be COVID-19, cough, fever, shortness of breath, GI symptoms, a new onset of loss of smell or taste, go get tested. There are literally dozens of places across the state of Maine where you can go and get tested for free to find out if you've got COVID-19. If you were exposed to somebody who you now know to have COVID-19, make sure you're quarantining for at least 14 days. If you were also exposed, you should go get tested at the same sites that I mentioned a second ago. And here's what I want to talk about for a second. It's not so much whether you should get tested if you were exposed, you should. The question is when. If you go rush out and get a test right after you were in contact with somebody who had COVID-19, your test result will almost certainly be negative and won't actually tell you anything about whether you've gotten COVID. That's because it takes the body a couple of days to develop an infection. It takes the virus a couple of days to reproduce to a level that the lab test can actually detect it. The best recommendations right now from the US CDC are to get tested 5 to 7 days after you were in contact with somebody who you know who had COVID-19. The other thing I want to talk about today that's very granular and very important is that if you were concerned enough to get tested for COVID-19 because you're not feeling well, or because you came into contact with somebody, or because your healthcare provider ordered the test, if you were concerned enough to get tested because of one of those reasons, and you're having symptoms, please stay home until you get your result. If you were exposed or you're not feeling well and you might have COVID-19, if you get tested, but then go about your life in the same way, you could potentially be infecting other people until the time you get that result. And if it's positive, you have potentially infected countless people around you. Again, if you were exposed or you have symptoms, stay inside until you get your results. If you were exposed to somebody who you now know has COVID-19, even if that test is negative, you still need to be in quarantine. I know that's hard. I recognize how tough that is. But a negative test for most people does not absolve them of the need to be in quarantine. The other thing I want to talk about is small gatherings. Now is the time to reconsider who you're interacting with. Indeed, just today, Governor Mills's executive order to take a step back in terms of the number of people who can be at large gatherings, both indoor and outdoor, has scaled back to 50 people. But I'm raising a related and equally important question of whether it's prudent not to get together in large gatherings, but with whom you get together even in small gatherings. Now, most of us know at this point that large gatherings, like parties, large weddings, any type of place where a large number of people may be gathering poses a high risk. But smaller gatherings pose an equal risk, especially as we are all going indoors because of colder weather. Small gatherings don't have the same stigma attached to them as do large gatherings. And even though they may be smaller, because they can be longer in duration and in smaller locations where people are breathing, eating, laughing, singing, and talking together for long periods of time, the risk posed by smaller gatherings can be pronounced. These innocent gatherings where you're having family and friends over, 4, 6, 8 people, where you're just coming together for a little while, can also be instances where a large number of people happen to get infected and later become sick. So as we go into the colder months, think not just of the large gatherings, but the small gatherings as well, because those can also be places of risk. And the final thing I'd like to offer everyone today is to reconsider how you think of preparedness measures. In my own head, I think of preparedness measures as a block of Swiss cheese. Each of the discrete slices that makes up a block of Swiss cheese represents a potential intervention or mitigation or defense that we can take to guard against COVID-19. Now, we all know that none of those slices is perfect. They all have holes, imperfections, gaps in their efficacy. Each slice invariably will have differing degrees in its ratio of cheese to holes, where the cheese represents protection and the holes may represent imperfections. But taken together as a block, they collectively improve the success of what we're trying to aim for here, which is reduction in the transmission of the disease. This is literally like dressing in layers of clothing when you know it's going to be cold outside. The more layers that you've got, the more efficacious your overall strategy is, the warmer you'll be. Masks are one of those slices, a part of the block of cheese. Physical distancing is another. Staying home if you're sick is yet another. Getting tested if you've got symptoms is yet another. When you put them all together, the effect of all of these slices of cheese isn't just additive, it's actually multiplicative. The point there is that if you think of your protection against COVID-19 as just one of these discrete things at a time, you're missing the fact that really what we all need to be doing is taking advantage of all of those at once, not just one of them. Sadly, cases of COVID-19 will invariably continue to increase across the state of Maine. And with that will sadly come additional hospitalizations and even more sadly, additional individuals who pass away. But right now, today, there are concrete things that each and every one of you can do to start keeping yourselves, your family, and your community safe. So with that, I'd like to turn things over to our colleagues in the media for questions. The first question for today goes to Patrick Whittle.
Thank you very much, and I appreciate the cheese analogy. I just wanted to make sure that I understand what's going on with the outbreak at the Maine Correctional Center in Windham. As I understand it, that's up over 80 cases, mostly inmates. I would like to know if the CDC or the DOC has yet been able to identify the source of the outbreak, and also just sort of like a general kind of status of what's going on over there.
Sure. For that latter piece, Patrick, with respect to the status of where they are, I'll refer you over to DOC. They can get you more exact details. But let me walk through where we are from the epidemiological public health side of things. As of this morning, there were a total of 88 cases associated with the Maine Correctional Center, 9 of which were among staff and 79 of which were among residents. They are all located in the same dormitories. The staff at DOC, the team at DOC is undertaking and working with Maine CDC to right now focus on broad-based testing. Indeed, many of the cases that they have recently identified have been as a result of universal testing among residents who are asymptomatic. With respect to the source, no source has been identified at this time. That is, of course, the focus of the investigation. As we gather more data around patterns of where people were and taking a holistic step at when people develop symptoms and then tracing their movements, We hope to have a better sense of how the outbreak may have been introduced. That is a challenge. It is the goal of the investigation, but at this time, we haven't identified a singular entry point for COVID-19 into the MCC. For the more operational details, again, my colleagues over at DOC would be able to give you more minute-by-minute updates.
Okay, thank you. Thank you so much for that.
Mm-hmm. I'm going to turn next over to Lauren Healy at WGME.
Hi, Dr. Shah. I'm wondering, with the increase of cases, how the supply of PPE is holding up. Will you guys need to request more from the federal government?
Sure. Our supplies of PPE, let me take a step back, Lauren. We, starting back in February, March, recognized that PPE was going to be a central feature of our response. As folks are aware, we started pushing out PPE long before we had our first case in Maine. And we've continued that. We've continued to make sure that healthcare facilities have what they need to keep themselves safe, their employees safe, as well as their residents. We've continued to push out PPE throughout the outbreak. And I think now is probably a decent time just to provide an update on where we stand with that. As of yesterday, at the close of business yesterday, Maine CDC's public health emergency preparedness team have pushed out 2,957,488 pieces of PPE to healthcare providers and other first responders across the state. We have also, during that entire time, made sure that our stockpile of PPE within the state was robust enough to go for at least a long period of time with COVID-19. Right now, for example, just in our stockpiles at the state level, we have approximately 350,000 N95 masks, almost 3 million surgical masks, about over 2 million gloves. So we've got a robust supply, but we're simultaneously taking a look at that to make sure it matches up with where we need to be for this next surge. Supply and availability are always a concern, given that it's not just Maine that is surging, it's the entire country as well as other continents. Where we are right now, I don't anticipate that there will be a shortage of PPE, but that's because of the advanced planning that we've done. We're simultaneously rechecking our numbers to make sure we've got enough to keep patients and healthcare providers safe going forward.
Thank you.
Mm-hmm. I am going to turn next to, next up is Steve Betts at the Courier-Gazette.
Hi, Dr. Shah. I just want to see if I could get an update on the outbreaks at the Midcoast Athletic Center in Warren and at the Woodlands of Rockland.
Sure thing. So at the Midcoast Athletic Center, there are currently 5 cases there. That was the number that we opened the investigation at. We've not detected or associated any additional cases. Similarly, as to Patrick's question at the MCC, we're trying to get a better sense as our investigation unfolds as to where the first case may have come from and what the chain of transmission may have looked like. And then with respect to the Woodlands Senior Living, the total number of cases there stands at 21. We have similarly working with the facility as they've undertaken rounds of universal testing there.
Thank you very much.
Mm-hmm. Next question goes to Morgan from WABI.
Hi, Dr. Shah. I have 2 questions. The first one is about this latest surge. Can you talk about, what sort of led up to this, if there's anything you can pinpoint, and if hospitals are feeling the impact? And then I also have a question about contact tracing after that.
Okay, so with respect to the surge itself, that it's not just Maine, which has experienced, it's been region-wide as well as country-wide, as well as continent-wide, looking into Europe as well. One of the drivers, according to Dr. Fauci, has been folks gathering back indoors as it's gotten chillier across the Northern Hemisphere. Morgan, there's also a hypothesis, and I can't stress enough that it is just a hypothesis at this point. It is a theory, not a fact at this point. But there are scientists who are investigating whether the weather itself, the nature of the weather right now, may have led to conditions that could generate more transmission. For example, whether the colder air is drier air. And so there are scientists looking at whether the drier air may reduce the size of the droplets and aerosols that carry the virus, thus allowing people to spread it over greater distances. If that's the case, that would help explain why we've seen more transmission. Now, Morgan, I can't stress enough, that is a theory. That is something that is under investigation. That is not scientific fact at this point. The US CDC has not signed off on that, but I have been reading papers and in discussions with researchers that I know who are looking into that. It's an idea. Like all scientific ideas, it needs further study.
And
then hospitals. Yes, we have kept in very regular contact with hospitals throughout the pandemic. And both on the front of PPE, as we were talking about a moment ago, but also to make sure they've got other necessary medical resources, as well as just the latest up-to-date research. What has been interesting in our discussions with hospitals is that the dispersion, the geographic location of patients has changed when you compare now against, say, March and April. Back in March and April, patients were largely being moved for care to some of the secondary and tertiary care centers in the major population centers in Maine. But now patients are able to be cared for closer to their homes at their local community hospitals. That's for a couple of reasons. It's partly because fewer patients need to be ventilated. That's a good thing. It's also because what we've talked about at these meetings, which is physicians, medical providers just have more experience with COVID-19 than they did back in March. But make no mistake, hospitals are feeling the strain of the increased number of cases. We're working with them to make sure they've got what they need to continue taking care of folks.
And then just one quick question about contact tracing. There was a recent hepatitis A situation at a restaurant in Bangor. The question came about if people are giving their information as they go to restaurants for coronavirus contact tracing, if that becomes a possibility, can that information also be used to contact them about a situation that they could have come in contact with someone with hepatitis A?
Yes, it can be. We're looking into, so we've been able to work with the restaurant in this situation to make sure that those who were affected are receiving word either from us or from the restaurant. But that is something that we have talked about and thought about whether we are able to do so. Again, the purpose for which we collect that information is not to keep tabs. It's in the event of a public health emergency, be it an outbreak of COVID or in this case, an outbreak of hepatitis A. We are able to get in touch with folks so that they can take measures to keep themselves safe. This is an added benefit of having that information so we can warn people. Hepatitis A is not something to be trifled with. It's a serious disease unto itself. So yes, that's an extra benefit of being able to collect that information.
Thank you, Dr. Shah.
Mm-hmm. I'm going to turn now to Lindsay Mills at News Center.
Good afternoon. I also have a couple of questions about contact tracing. How many does the state currently have, and have there been issues with people not cooperating?
So, Lindsay, right now, our team of case investigators and contact tracers stands at just over 100. I want to be really clear, and this goes back to something we've talked about. In light of the increase in cases, we are also taking strong and quick steps to add more folks to that force. We are redeploying staff within the Maine CDC who have previously worked in those roles to go back to working in those roles. We're also working with others across the administration, both to make sure that if they have been previously trained in case investigation or contact tracing, they are now able to be redeployed to Maine CDC to assist, given what we know to be the surge in cases. With respect to the cooperation, we have not had systematic reports of individuals who have declined to cooperate with our contact tracing or case investigation efforts or processes. I'd say overall, statewide, the buy-in for what we are trying to accomplish by this has been good. But this is a reminder for everybody that if you get that phone call, and if you look at your phone and you're seeing a call and it says Maine Center for Disease Control and Prevention, please pick up the phone, because the information that may be relayed to you by the person from our agency who's calling is information that could keep you and your family safe and healthy. Next up is Joe Lawler at the Press Herald.
Yes, hi. I also have some questions about contact tracing. So you're saying that you're going to increase the workforce. Do you have a target number, like, from 100 to 125 or 150, or what's the target?
Yep. So Joe, we're going to do it gradually. And so it's kind of, we're turning up the dial. It is the right way, is the way I think about it, Joe. So immediately starting on Monday, I actually just a couple of hours ago sent an email to the entire Maine CDC indicating that anyone who's previously been trained as an investigator needs to be working with their immediate supervisor to redeploy to start working again. We're taking a look, because that's a lot of folks. We may not need every single one of them. We're going to take a look at the numbers. It's probably in the immediate term going to be on the order of about 20 extra people for Monday. And then we're also bringing on others who will go through a training course that also starts on Monday. It's a 2-week training course that will prepare them to be case investigators at the completion of that course. We've got a class that starts on Monday with, I believe, 12 people in it. So that will prepare them 2 weeks after that to start working. And then we're going to be running yet another class after that. So it's kind of it's a stepwise process, Joe. We're continuing to turn up the dial to make sure we're calibrating it so that all the new cases can be investigated.
Okay. And I heard you, if I heard you right, you can have 20 extra people starting as soon as this upcoming Monday. Is that right?
That's right. Now, not all of those folks, just to be clear, not all of them will be full-time. Some of them will be part-time, depending on the workload that they've currently got. Thankfully, we've still got to keep other aspects of Maine CDC going. So some of those folks may be part-time, but others may be able to peel away from their current positions full-time. So the exact number that will ultimately redeploy starting on Monday will depend on what percentage can be full-time and what percentage will be part-time. If in whatever we need to do, whether it's everybody part-time or a smaller number, a smaller subset full-time, that will ultimately determine what the exact number is come Monday.
And so even if we have, like, say 200, 250 cases a day, in the coming weeks, hopefully we won't have that, but say we do, you would have enough people to contact trace everybody, or you will? No?
It'll be a challenge. That'll be a challenge.
Okay. Yep. And if I could just, I'm sorry, I know.
No, it's okay. Sorry, Joe. I just want to say, I don't want to overpromise. If we get up to 200, 250 cases, we're going to keep turning the dial up, but there is a little bit of there's a bit of lead time in the system. So it may take us a couple days, maybe even longer, to get the dial to where it needs to be if we get to that case number. I don't want to sugarcoat this for anybody. This is tough, and this will be a challenge. That's really why I need everybody to do their part as well. So we hopefully don't get to that.
Okay, and just one quick question on the prison outbreak. Do you have a sense yet of whether there was masking going on? I know the policy was to have the inmates and the staff mask, but was there widespread masking, or were people ignoring those rules?
Joe, I know that is the policy, and I speak every single day, every morning with the deputy commissioner at DOC to make sure we're both on the same page. And I understand that masking, I know that's the policy, and I understand that it was widespread. but I'm not a primary source there. I really would refer you to DOC. They would be able to tell you exactly what was in place and what was being adhered to.
Thank you.
I'm going to turn next to Amy Brown at WERU.
Thank you, Dr. Shah. Just a quick follow-up first. The Hope Baptist Church that you mentioned in Kennebec County, is that the one in Manchester? I didn't catch if you specified.
Yes, that is the one in Manchester, Amy.
Okay, thank you. And did I understand you to say that if someone has been exposed to someone who turns out to test positive, they should quarantine for 14 days, even if they test negative? And if so, what should people do if they become aware of someone working in a public facing position who's been exposed but is not following that recommendations, is not getting tested, is not quarantining? We actually had a report of that yesterday from a listener, and they wondered if it depends on the length of exposure. It might have been somewhere in the 15 to 30 minute range. Does that person still need to get tested or quarantined? How does that work?
Sure. So let's first start with the rationale behind why, because it seems weird, right? It seems as if you were exposed and you wait a couple of days and you test negative, you should be fine, right? But what can happen is that the virus can take different amounts of time to reproduce and replicate in different people. Indeed, I was recently speaking with somebody who had a family member who was exposed and tested negative on day 7. But then on day 14, the last day of quarantine, tested positive. That's why even if you've been exposed, even if you get a test on day 5, 6, 7, or 8, it's still important to follow through with the balance of your quarantine because you can still test positive even after that. Now, Amy, this is a rule that we use for the general population. There are certain special categories of folks for whom, if they've been exposed, if they work in critical infrastructure, there is a slightly different set of approaches to them. But I just want to be clear, this is the way we approach it for 99.9% of the people. For individuals, now what we consider, to the heart of your question, what matters here is what is meant by being exposed. It's not that you happen to pass by somebody in the hallway. It really does require at least 15 cumulative minutes of being within 6 feet of somebody. That's what we would consider an exposure. So, I can't specifically answer the scenario that you laid out because it does depend on the facts. And the key is whether there was that 15 cumulative minutes of being within 6 feet of somebody.
So what does someone do if they're aware of someone working in a public-facing position who has been exposed and hasn't followed those recommendations? I mean, presumably they may pose a risk to the people that they are interacting with, particularly if they're not wearing PPE. So what does someone do if they're aware of that kind of situation?
Yep. The best thing to do there is to speak with the owner, operator, or manager of the facility. That's probably the best and most immediate route. There may be unknowns that the person is not aware of that might alter that calculus. So I don't want to presume that each and every one of these situations is on equal footing with the others. I think the best thing to do is to either speak with that person or the owner, operator, or manager of the facility.
Okay, but there's nothing within the state that people can do if the same person is the owner operator.
If someone has been exposed and the person who exposed them listed them as a close contact, then our contact tracers should be reaching out to them.
Okay, thanks.
Next up is Allison Ross at WMTW.
Hi, Dr. Shah. Thanks so much for taking my question. So just back to contact tracing. Now, originally when this pandemic kind of began, we were seeing a lot of cases coming from outbreaks. And now that it's switching to community transmission and household transmission, how has the process changed at all, or has the contact tracing process changed at all during these past few months?
It's an interesting question, Allison. The answer is that the contact tracing process, the fundamentals of this type of public health advice haven't changed. which seems interesting. It may seem, may strike folks as a bit out of sorts, because I've talked about how the outbreak and the pandemic now are different than what it was back in March. But the fundamentals, the way that we investigate individuals who have tested positive and then talk to their close contacts to give them advice on how to stay safe, how to get tested, how to look out for symptoms, those bedrock fundamentals of public health, those actually haven't changed. So although much else has changed in the complexion of the outbreak and the pandemic, those really fundamental things, getting tested if you're feeling symptomatic, staying inside after you get tested until you get your result, how we do contact tracing, how we do case investigations, those core approaches have largely remained intact.
Great, thank you.
Next up is Patty White from Maine Public.
Thanks, Dr. Shah. So the recommendations that you've given about how important it is for people who've been exposed to get tested and to remain in quarantine, are you making those recommendations based on what you're seeing in this surge of cases? I mean, in other words, is that a factor that's contributing to the spread in addition to these small gatherings? Is it that people are not staying in quarantine when they should be when they're exposed?
I don't have any concrete data on that one. I have heard from colleagues across the country that there is a degree of quarantine fatigue setting in. I've read such reports, but Patty, I don't have data or experiences in Maine that I can point to, just to be clear. I offered that as a reminder for what quarantine is and why it's important, not because of any event or events that precipitated that. The same with respect to staying indoors in isolation after you've gotten a test. I have heard from people that I know who have gotten tested, but then were back out at work. And I've sort of said to them, wait a minute, if you were concerned enough to get tested, it meant that you thought you could have COVID, which means you need to be inside. So again, I don't have any data there. That was just a little bit more from personal experiences. And really just as a reminder, as we're starting to see cases, these things like limiting chains of transmission are going to be more important than ever.
Okay, thanks. And then I've got a question about some of the church outbreaks. Is the outbreak at the Deeper Life Assembly Church linked to cases or outbreaks at other churches like Brooks Pentecostal or the Faith Bible College and the Charleston Church?
First, let me just provide an update on the Deeper Life Assembly. The total number of cases there is 11. We are investigating whether any of these outbreaks among various different houses of worship are related in any way, whether there was a larger communal gathering that preceded them, so on and so forth. At this time, we have not identified any linkages between the Deeper Life Assembly and any others. As I think I mentioned, though, with respect to the Brooks Pentecostal, there was a linkage based on a revival event that occurred earlier last month between the Brooks Church and the Bible College. But as to Hope and Deeper Life and Second Baptist, we have not identified any linkages among them yet. That doesn't mean they're not there. Our investigation is ongoing. We're trying to see if there are. And the purpose, of course, is not just to identify linkages for linkage's sake. It's to identify other gatherings that may have occurred where there may be others who we don't know about yet that could have been affected. That's the reason we're trying to piece that together.
Okay, thank you.
And the final question for the afternoon goes to Charlie from the BDN.
Yep. Hi, Dr. Shah. Thank you. One of my questions, just a quick follow-up on the Pittsfield church outbreak. I know you said you have not identified linkages to other church outbreaks, but have you learned anything about what may have contributed to that outbreak?
The short and straight answer there, Charlie, is not yet. Initially, we detected that there were the church was attended by folks, by multiple families. And so we haven't quite yet determined which of those individuals or families may have been the first to become ill or where they may have gotten it. So no, at this time, we haven't pinpointed a particular source of that outbreak. As with many outbreaks, as the rate of cases, the background rate of cases in the community goes higher and higher and higher, the likelihood that a number of people who might simultaneously have COVID at the same time come together for a particular event, be it a dinner party or a worship service, that likelihood goes up as well. So that makes it difficult to disaggregate where a particular outbreak may have started or by whom.
Okay, and a question about the Calais Hospital, and then I'll have just one final quick question after this. But do you know how many of those 5 cases are in staff versus patients? And again, have you determined whether the virus is circulating, within the hospital or whether they caught it outside?
Charlie, one note: the number is 6 at the Calais Regional Hospital, not 5.
Okay.
And unless this has changed since 10 a.m., and if it has, we'll let you know ASAP. But it is my understanding that all 6 of those cases are among staff members. If that has changed since 10 a.m., we will let you know. And similarly to your inquiry about the churches, given that this is a workplace outbreak, we go back to that central question in workplace outbreaks, which is, did the transmission occur in the workplace setting, or are we just picking up transmissions that may have occurred elsewhere in the community, but happen to coalesce around a workplace? That's always the central question in a workplace outbreak. With respect to the Calais Regional Hospital, we haven't determined yet. And again, we just opened that about 24 hours ago. So we haven't determined whether any transmission occurred within the hospital or whether it was incidental and found at the hospital itself. We're working very closely with them. They were already doing testing. So we're working closely with them to cast a slightly wider net to make sure we're capturing other potential affected employees. At this time, I'm not aware of any patients. But again, if that's changed since 10 a.m., we will make sure we let everyone know.
Okay, and thank you. And just have any of the recent coronavirus deaths in Maine been in people tied to any of these recent outbreaks?
I can confirm that the death that I reported today in a man in his 70s from Waldo County was sadly linked to the Brooks Pentecostal Church outbreak. Not directly, but indirectly.
Okay. Thanks, Dr. Shah.
Mm-hmm. All right. Well, thanks to everyone in the media for their questions this afternoon. And thank you all for dialing in and joining and watching today. Before we adjourn for the afternoon, just a reminder that although case numbers, positivity rates, and hospitalizations are rapidly increasing in Maine, that does not mean we should give in to the fatigue that we are all feeling. We're all tired. But COVID-19 remains serious and is growing even more serious with each passing day. Right now, today, there are concrete things that you can do to keep yourself, your family, and your community safe. Whether it's going out and getting a flu shot, or making sure you're checking who you're in your bubble with, or making sure you're following the right guidelines to get tested and then avoiding spreading whatever you've got after you get tested. There are still so many things that each and every one of us can do to help keep a lid on COVID. I know we're all tired. Pandemic fatigue has set in, and the pandemic fatigue is real. But we must resist the temptation and the urge to give into it. There is simply too much at stake. What we've seen in other parts of the country, as well as earlier with the outbreak in Maine, is that as cases rise in the community, they then start appearing in places where vulnerable members of our community are, whether that's long-term care facilities, whether that's hospitals. The best way that we can keep people who are vulnerable safe from COVID is by taking care of ourselves and not letting the virus enter the places where we know they are. Even if you're not doing it just for yourself, take steps today to keep everybody else, particularly the most vulnerable among you, as safe as possible. So with that, again, thank you all for spending some of your afternoon hearing the latest on COVID-19. As always, I ask you to please be kind and take care of one another. We will all talk again soon.